हेलो फ्रेंड्स, आज पैथोलॉजिकल प्रैक्टिकल बुक हर्ष मोहन राइटर जो लिखे हैं उसको आज हम लोग पढ़ेंगे। तो जो सेक्शन 1 है टेक्निक्स इन पैथोलॉजी, इसमें 3 चैप्टर है। माइक्रोस्कोपी ऑफ वेरियस टाइप्स, लाइट माइक्रोस्कोप, अदर टाइप्स ऑफ माइक्रोस्कोपी, रिसेंट एडवांसेस इन माइक्रोस्कोपी, और दूसरा है हिस्टोपैथोलॉजी टेक्निक्स इन रूटीन स्टेनिंग, जिसमें कि फिक्सेशन, डिहाइड्रेशन, क्लीनिंग, इम्प्रेगनेशन, टिश्यू प्रोसेसर, embedding and blocking, section cutting, microtomy, routine staining, H&E। फिर एक्सरसाइज 3 है फ्रोजन सेक्शन एंड स्पेशल स्टेन्स, फ्रोजन सेक्शन स्पेशल स्टेन्स। तो चलिए शुरू करते हैं। सेक्शन 1 टेक्निक्स इन पैथोलॉजी। एंटोन वॉन लिवेनहुक 1632 से 1723, born in Holland, draper by profession. During his spare time, invented the first ever microscope by grinding the lenses himself and made 400 microscopes. He also first introduced histological staining in 1714 by using saffron to examine muscle fiber. सेक्शन 1 टेक्निक्स इन पैथोलॉजी। ऑब्जेक्टिव्स क्या क्या है? तो आफ्टर स्टडिंग दिस सेक्शन द स्टूडेंट शुड बी एबल टू गेन नॉलेज एंड लर्न द फॉलोइंग स्किल्स, जो कि लर्न द वर्किंग ऑफ वेरियस पार्ट्स ऑफ ए लाइट माइक्रोस्कोप, ऑपरेट एंड मेंटेन द लाइट माइक्रोस्कोप, लर्न द ब्रॉड प्रिंसिपल्स ऑफ अदर फॉर्म्स ऑफ माइक्रोस्कोपी, डिस्कस फिक्सेशन ऑफ टिश्यूज फॉर रूटीन प्रोसेसिंग इन हिस्टोपैथोलॉजी laboratory, to be familiar with the equipments and basic technique of routine histopathology processing of tissues in the laboratory, learn the routine H&E staining for tissue sections, learn the technique, applications and stain used for frozen sections, learn broad principles and end results of common special histochemical stains. Section contains microscopy of various types, histopathology techniques and routine staining, frozen section and special stains. Microscopy of various types. 3 points: light microscope, other type of microscopy, recent advances in microscope. Microscope is the most commonly used piece of apparatus in laboratory. It produces greatly enlarged image of minute objects. Common light microscope is described first, followed by the other special type of microscope technique. Light microscope. A light microscope can be a simple or a compound microscope. Simple microscope, this is a simple hand magnifying lens. The magnification power of hand lens is from 2x to 200x. Compound microscope. This has a battery of lenses which are fitted in a complex instrument. One type of lens remain near the object, जिसको हम लोग ऑब्जेक्टिव लेंस कहेंगे, and another type of lens near the observer's eye, जिसको आईपीस लेंस कहेंगे. The eyepiece and objective lenses have different magnifications. The compound microscope can be monocular having single eyepiece, figure 1.1, or binocular which has 2 eyepiece, figure 1.2. The usual type of microscope used in clinical laboratory is called light microscope. A compound microscope has the following parts: a stand, body, optical system, light और illuminating systems. तो फिगर 1.1 में मोनोकुलर लाइट माइक्रोस्कोप है और फिगर 1.2 में बाइनोकुलर लाइट माइक्रोस्कोप। अब एक एक पार्ट को पढ़ते हैं। स्टैंड, बॉडी, ऑप्टिकल सिस्टम, लाइट और इल्यूमिनेटिंग सिस्टम। स्टैंड क्या होता है? तो दिस इज ए हॉर्स शू टाइप shaped in monocular microscope. It gives stability to the microscope. Binocular microscope have a variety of ergonomic shape of stands. दूसरा है body. It consists of a limb which arises from the point with which microscope can be moved in comfortable position. The stand and the limb carry the following body tubes, stage, knobs for coarse and fine adjustment. Body tubes. There are two tubes, external tubes which carries at its lower end or revolving nosepiece having objective lenses. Then body tubes there are two tubes, external tubes which carries at its lower end a revolving nosepiece having objective lenses of different magnifications, while internal tube is draw tube which carries at its upper end eyepiece. तीसरा है stage. This is a metallic platform which accommodates glass slides having mounted object over it to be seen. A stage is attached to the limb just below the level of objective. It has an aperture in its center which permits the light to reach the object. Slide on the stage can be moved horizontally or vertically by two knobs attached to the side holder. Just below the stage is substage. Which consists of condenser through which light is focused on the object. The substage can be moved up and down. The substage has an iris diaphragm, closing and opening of which controls the amount of light reaching the object. Knobs for coarse and fine adjustment. For coarse and fine adjustment, knobs are provided on either side of the body. Coarse adjustment. For coarse and fine adjustment, knobs are provided on either side of the body. Coarse adjustment has two bigger knobs, the movement of which moves the body tubes with its lenses. Fine adjustment has two smaller knobs on either side of the body. The fine focus is graduated, and by each division, objective moves by 0.002 millimeter. Optical system. Optical system is comprised by different lenses which are fitted into a microscope. It consists of eyepiece, objectives, and condensers. Eyepiece. In monocular microscope, there is one eyepiece, while binocular microscope has two. Eyepiece has two plano convex lenses. Their magnification can be 5x, 10x, and 15x. Objectives. These are made of a battery of lenses and with prisms incorporated in them. Their magnification power is 4x, 10x, 40x, and 100x. Condenser. This is made up to two simple lenses, and it condenses light onto the object. Light or illumination system. For daylight illumination, a mirror is fitted which is plane on one side and concave on the other side. Plane mirror is used in sunlight, while concave in artificial light. Currently, most of the microscopes have inbuilt electrical illumination varying from 20 to 100 watts. Magnification and resolving power of light microscope. Magnification power of the microscope is the degree of image enlargement. It depends upon the following. First, length of optical tube. दूसरा मैग्नीफाइंग पावर ऑफ ऑब्जेक्टिव, तीसरा मैग्नीफाइंग पावर ऑफ आईपीस। मैग्निफिकेशन एंड रिजॉल्विंग पावर ऑफ लाइट माइक्रोस्कोप। Magnification power of the microscope is the degree of image enlargement. It depends upon the following: पहला लेंथ ऑफ द ऑप्टिकल ट्यूब, दूसरा मैग्नीफाइंग पावर ऑफ ऑब्जेक्टिव्स और तीसरा मैग्नीफाइंग पावर ऑफ द आईपीस। With a fixed tube length of 160 mm, in majority of the standard microscope, the magnification power of the microscope is obtained by the following: magnifying power of objective into magnifying power of eyepiece. Resolving power represents the capacity of the optical system to produce separate images of objects very close to each other. Resolving power R is equal to 0.61 lambda per Na यानी numerical aperture of lens, where lambda is the wavelength of incidental light and Na is numerical aperture of the lens. Resolving power of a standard light microscope is around 200 nanometer. How to use a light microscope? कैसे यूज करेंगे? पहला, keep the microscope in comfortable position. Then, to obtain appropriate illumination by adjusting the mirror or light intensity of light. Then, when examining colorless objects, condenser should be at the lowest position and iris diaphragm closed, so partially closed. When using oil immersion, 100x objective should dip in oil. After using oil immersion, clean the lens of the objective with tissue paper or soft cloth. Other type of microscopy: dark ground illumination (DGI). This method is used for examination of unstained living microorganisms. Example: Treponema pallidum. Principle क्या है? तो the microorganisms are illuminated by an oblique ray of light which does not pass through the microorganism. The condenser is blackened in the center and light passes through its periphery, illuminating the living microorganisms on the glass slides. फिर है polarizing microscope. This method is used for demonstration of birefringes. Example: amyloid, foreign body, hairs, etc. Principle क्या है? So the light is made plane polarized. Two discs made up of prism are placed in the path of light. One below the object, known as polarizer, and another placed in the body tube, which is known as analyzer. Polarizer sieves out ordinary light rays vibrating in all directions, allowing light wave of one orientation to pass through. The lower disc polarizer is rotated to make the light plane polarized. During rotation, when analyzer comes perpendicular to polarizer, all light's rays are cancelled or extinguished. Birefringent objects rotate the light rays and therefore appear bright in a dark background. फिर नेक्स्ट है फ्लोरेसेंट माइक्रोस्कोप. इसमें क्या करते हैं? दिस मेथड इज यूज्ड फॉर डेमोन्स्ट्रेशन ऑफ naturally occurring fluorescent materials and other non-fluorescent substances or microorganisms after staining with some fluorescent dyes. Example: Mycobacterium, tuberculosis, amyloids, lipid, elastic fibers, etc. UV light is used for illumination. Principle क्या है? तो fluorescent microscopy depends upon illumination of a substance with a specific wavelength, UV regions, that is invisible region, which then emits light at a lower wavelength, visible regions. Electron microscopy. This is used for a study of ultra structural details of the tissues and cells. For electron microscopy, tissues is fixed in 4% glutaraldehyde at 4 degrees Celsius for 4 hours. Ultra thin microsections with thickness of 100 nanometer are cut with diamond nibs. Principle क्या है? तो by using an electron beam of light, the resolving power of the microscope is increased to 50,000 to 1 lakh times, and very small structures can be visualized. In contrast to light microscopy, resolution of electron microscopy is 0.2 nanometer or less. There are two types of electron microscopy. First, transmission electron microscopy और दूसरा scanning electron microscopy. Transmission emission electron microscopy. So TEM helps visualize cells, cytoplasm and organelles. For this purpose, ultra thin sections are required. TEM interprets atomic rather than molecular properties of the tissues and gives two-dimensional image of the tissues. Scanning electron microscopy (SEM). SEM helps in the study of cell surfaces. In this, three-dimensional image is produced. The image is produced on cathode ray oscillograph, which can also be amplified. SEM can also be used for fluorescent antibody techniques. Recent advances in microscopy. कुछ एडवांसमेंट भी हुआ है क्या? In recent time, computers and chip technology have helped in developing following advances in microscopy. पहला है image analyzer and morphometry. In these techniques, microscopes are attached to video monitors and computers with dedicated software systems. Microscopic images are converted into digital images and various cellular parameters, example nuclear area, cell size, etc. can be measured. This quantitative measurement introduces objectivity to microscopic analysis. फिर है टेलीपैथोलॉजी वर्चुअल माइक्रोस्कोपी. It is the examination of slides under microscope setup at a distance. This can be done by using a remote control device to move the stage of the microscope or change the microscope field or magnification, called as robotic telepathology. Alternatively, and more commonly, it can be used by scanning the images and using the high-speed internet server to transmit the images to another station, termed as static telepathology. Telepathology is employed for consultations or for another expert opinion or for primary examinations. तो फर्स्ट चैप्टर कंप्लीट हो चुका है, मतलब फर्स्ट टॉपिक. नेक्स्ट है हिस्टोपैथोलॉजी टेक्निक्स एंड रूटीन स्टेनिंग. इसको हम लोग नेक्स्ट वीडियो में देखेंगे. थैंक यू, बाय.